Welcome to the Brain People Podcast, a show where four mental health experts team up to bring you practical tools for overcoming mental health challenges. The Brain People don't replace your doctor or therapist, but we will give you some extra tools to help you on your journey. So join us as we fight mental illness, one episode at a time. Welcome to the Brain People Podcast. I'm your host, Dr. Daniel Binus, and I'm joined today by my co-host.
Hi, everyone. My name is Dr. Katie Cruz. I'm a licensed clinical psychologist.
All right. Today, we are going to be talking about a hot topic, and that is complex PTSD. So, complex post-traumatic stress disorder. And this is a topic that's actually gained quite a bit of traction over the last few years. And some people might be confused how this is different than your classic PTSD. So, Dr. Katie, can you just elaborate a little bit on what complex PTSD is, how that's related to potentially PTSD, post-traumatic stress disorder, and we'll go from there.
Yeah, so I think to answer that, it helps to know kind of the journey that really the field has been on to understand PTSD, and I would say maybe trauma at large. And so come with me on a journey of history, very simplified, but basically, about in the 1980s early 1980s is when PTSD was recognized as a diagnosis. And a lot of that research came from Vietnam veterans. And so with PTSD, there was an emphasis on this life-threatening event, very extreme event that would cause a host of different symptoms, which we can talk a little bit more about. But basically, so PTSD was recognized of these symptoms that were happening, a lot of distress in relation to an event. As time went on, however, people started to realize, well, what about individuals who have had prolonged experiences? So not just maybe a life-threatening event, whether combat-related or even like a natural disaster or a car accident, but ongoing, multiple chronic and complex traumas. And people started realizing, not only is there a difference in the experience, and so maybe I don't fit the criteria for PTSD in relation to the experience, but also the symptoms are slightly different. And that started to raise questions in which some people were being misdiagnosed with a host of both PTSD as well as other personality disorders. And so they questioned, is there a better diagnosis? And in 1988, Dr. Judith Herman proposed complex PTSD as a diagnosis that better captured a lot of individuals' experiences that had exposure to prolonged trauma and more complex symptoms than the PTSD diagnosis presented with.
So you might almost say that the importance of this topic and complex PTSD is really being able to identify individuals who have suffered from trauma, but maybe not those classic, like, huge one-time event sort of traumas, like you said, a war or a natural disaster or a rape or a car accident. And so maybe it's just not just one-time thing, but it's chronic, ongoing, long-term traumas. And sometimes these traumas might not be as profound, if you will, or as crazy, as dramatic, maybe is a better word of saying it. But especially over time, they have a huge effect on somebody. And so does that mean that, they don't meet criteria for PTSD, so I don't know what's wrong with them. I guess they just have an anxiety disorder. That doesn't quite fit, right? So That's where the idea of complex PTSD comes in, where we say, okay, there is this person here really is suffering from trauma, even though it's not that classic, dramatic, one-time event sort of trauma. Is that?
Yes.
Okay.
And then another layer to that is maybe it is that extreme, but perhaps especially because it's hidden by shame, years later, they're still suffering, but they don't meet the classic PTSD symptoms like flashbacks, for example. And so a provider is assessing them and saying, oh, you do not have active PTSD symptoms specifically, therefore you're not dealing with trauma. And so it's either for those who have not experienced such a life-threatening, extreme trauma, but still chronic experiences that overall add up to having extreme distress, or the opposite, where it is extreme, but perhaps they don't meet the active symptoms of PTSD, and those extreme events just contributed to other presentations that still cause them distress, but not in the same way that PTSD presents itself.
Yeah. No, and I think it's a very important point that you're making, because what I've seen happen actually with a lot of my patients is that they will be confused about, why am I the way I am? And often to the point where they've been misdiagnosed. Sometimes bipolar, you mentioned borderline personality disorder, maybe just an anxiety disorder or major depression. While there might be elements of some of those symptoms, et cetera, a lot of times, in my view as a clinician, I look at this individual and I say, wow, they've had so many childhood traumas. Could there be a CPTSD element? And I think that's important to kind of connect those dots, because if we're going to help people to get better, we need to understand, well, what's the root cause here? Is this just primarily biological? It's like a bipolar thing? Or, is they're just worrying too much? Or what's the core of what we're really dealing with? Because those core issues need to be dealt with for people to get better, right?
Exactly. And I think a lot of times we have been focused on symptoms and symptoms alone. And if you take that approach as a provider, as well as a person who's experiencing these things, I may not fit certain clusters of symptoms, or I may fit some, but it doesn't really address the root. And therefore, I'm going to stay in this cycle of symptom management.
Yeah, absolutely. Now, as we're talking about some of those roots, like what kind of traumas would be typical for people to experience that could trigger CPTSD? And we're not going to try to do a exhaustive list here, but just what would be some common things that we might see that would trigger CPTSD symptoms?
Yeah, so a key word to think about is prolonged. And so one of the most common examples is childhood abuse. And within childhood abuse can include all the different forms of abuse, but also childhood neglect and abandonment. That's often one that's not acknowledged. So we think about trauma being abuse, but neglect and abandonment, the absence of good happening, can also be in a chronic nature very problematic and can create the symptomology of complex PTSD. So under the umbrella of childhood abuse. But beyond that can be other situations. So for example, another very common one would be domestic violence, or any sort of interpersonal, intimate relationship. And with that chronic nature, that's what really creates the complex PTSD. So if it's just one-time relationship, or let's say one experience, that might fall along the PTSD diagnosis, but it's the chronic nature. Torture, we forget about that. So some veterans, for example, can both have PTSD as well as suffer from complex PTSD, especially with the ongoing nature of exposure to that trauma. Kidnapping, there are people who've experienced kidnapping. Let me see, what else? There may be, you've been part of a cult, prostitution, different experiences that are extreme, that are chronic, prolonged, and a lot of these really, if you think about it, are in the context of relationships. And that's going to be really key when we later talk about some of the symptoms that are unique to complex PTSD. But a lot of it, and I'm not going to, try to think about every single instance, but a lot of it has to do with relationships, and then very unhealthy, toxic relationships, and prolonged.
Yeah, and even as you're talking, I'm sitting here thinking about a lot of these are common elements of the study where they did with Kaiser with the adverse childhood experiences study, where they were looking at different adverse childhood events that could take place and then really cause health problems both mentally and physically in adulthood. And a lot of those elements were there, the abuse, the neglect, the domestic violence, even watching it in the household, having an addicted parent. And so unfortunately, for a lot of people that have some degree of trauma in childhood, it often is not just one, it's multiple layers that can contribute. And as you alluded, it doesn't always have to be in childhood, right? I mean, it could be like, hey, my childhood was actually pretty good, but then I got into a relationship with a partner, and then I started getting, abused by them. One question I would have, though, too, do you think that there's times where even emotional abuse by itself could also trigger some of these CPTSD symptoms?
Of course, yes. So sometimes people, when they think about PTSD being life-threatening, and then they say, well, complex PTSD, like emotional abuse or other things, neglect, how can that really be traumatic? But you have to understand, especially for children, how they perceive danger. So if a parent tells them, you are stupid, you are nothing to me, a child is completely dependent upon a parent for survival. So if you take it from that perspective, you can see the impact that neglect and emotional abuse or other similar things have on a child or even in an intimate partner relationship. And I love talking about that because I think so many people have either been invalidated or invalidated themselves of saying,
Yes.
I haven't experienced that bad of trauma,
Right.
but I'm still suffering similarly. How does that get explained? And DBT, I love DBT. We'll talk about that invalidating social environment and how impactful in a negative way it is to a child and just an individual's well-being.
Yeah, that makes a lot of sense. And it reminds me also, going back to that adverse childhood experiences study, that they found that the emotional abuse element was actually the statistically significant, the worst type of adverse experience a child could have, as far as like the outcome later on in life. And so it goes to show, like you said, there's the safety element. And then, of course, with the emotional abuse, it's also, if I'm telling my child that they're stupid or they're worthless, or I'm the child and I'm hearing that, that's how do I form my identity? Well, I'm forming my sense of self, like who I believe I am, from the messages I'm getting from those people around me. And so if that's what I'm being told, especially by someone important to me, like my mother or father, then that really affects the core of who I am, who I believe I am for the rest of my life, unless, I do a lot of work to change that.
Yeah, a good book. It's called A Boy Who Was Raised as a Dog by Dr. Perry. He's a psychiatrist who works with children, and there are different chapters on different children, but he educates us of the importance of development and, the connection with a parent and a secure attachment and so forth, and how that impacts a child, even from as simple as a child being neglected in the crib, right? So he talks about the common examples of the Russian orphanages and how that children being just left alone, just not attended. So nothing bad happening in the sense of something inflicted upon them, but even not receiving, so that's the neglect component and abandonment, not receiving nurture and care significantly impacts the emotional development of a child and results in symptoms that we're talking about similar to complex PTSD.
Oh, that's fascinating. So, some people argue and say, well, if you look at the symptoms of CPTSD, they're actually, there's of course a lot of overlap with PTSD, but then also even with borderline personality disorder. So why should we even care about differentiating between like borderline personality disorder and CPTSD, especially if someone presents with very similar or maybe even the same symptoms, or you could say, well, I could probably diagnose them basically with either one.
So I think to clarify for people why people confuse sometimes CPTSD with BPD is that one thing that three main symptom clusters that differentiate PTSD from CPTSD is emotion dysregulation. So chronic emotion dysregulation, people really struggling with regulating their emotions. Then two, a disruption in their sense of self and their identity, their self-concept. Then number three, having chronic difficulties with relationships. And so people hear that and they say, well, that's BPD. And there is a lot of overlap. And some people even argue, is that a separate diagnosis? BPD, or have we found a new diagnosis that better captures what actually has happened? Two things to distinguish BPD from CPTSD is BPD is often diagnosed by young adulthood. And so there's the age factor, and that's why it's a personality disorder. It starts from young, versus CPTSD can be diagnosed later on in life. So kind of like you were using the example of someone having a good childhood, and then later on, whether through combat, whether through domestic violence or another experience, they could develop it later on. So that's one main differentiation. And then the other, and I hope it's coming to me, is the cause. So BPD doesn't always have to have the cause of trauma, whereas CPTSD does. It's very focused.
Mm-hmm. Yeah. So that makes a lot of sense, because then again, when we're looking at CPTSD, we start to understand like, okay, well, there is actually a specific cause that's more than just kind of the biological predisposition, where BPD, yeah, there can be, some traumatic element, but there isn't always that present. Am I understanding that correctly?
Yeah.
Okay.
Mm-hmm.
Yeah. So that makes a lot of sense. And I think it is important that people do differentiate that so they can understand the origins and then address that to get better. So let's talk a little more about some of the specific symptoms and things that someone might experience when it comes to dealing with complex PTSD.
Yeah, so we'll be talking about these symptoms specifically using Dr. Judith Herman's kind of her list. If you look it up, there are different ways that people talk about them, but they're all generally the same. And then the first one that it's important to keep as a foundation is kind of what we've already been talking about, of like what qualifies as trauma. So I'll read in her language, but then kind of specify a little bit more. But I do think some of the words she uses captures the difference between just kind of a one-time event versus a prolonged experience. She says a history of subjection to totalitarian control over a prolonged period, months to years. And then she goes on to give some more examples. But they're big words that she uses. But one thing that you notice is the subjection. There's this so like with children, the children to the parent, or with prostitution, right? The individual to, and you could really think about this of like victim, perpetrator, but there's a subjection in which you feel like you cannot escape. And that happens, it's prolonged from months to years.
There's a power differential,
yes,
for sure.
That's a good way to put it.
Yeah.
Mm-hmm. Yeah. So that's often the kind of definition that's used to understand. So it's not just I'm in a relationship that is somewhat abusive and I can leave, but I'm with it enough to know that I can leave, but I'm choosing to stay. There's not that subjection element. Mm-hmm. And I think that's important to emphasize, because sometimes we, looking for a victim identification, can place ourselves there with the intention. Now, there's people that are definite victims, but there are people who utilize it, sometimes even from a narcissistic perspective, as a way to put others in subjection to them. So this is different. This is, you are in an actual relationship or dynamic that is in putting you in subjection.
Where you're really dependent on them. In a way, you kind of almost need them for survival, or
yes.
at least feel that you need them for survival. And so they have that power over you to do you a lot of harm, right?
And when it says the totalitarian control,
Yeah.
is that there is that differential in a way that subjection, I'm down here, and then someone here, totalitarian, is in complete control.
Yeah, that makes sense. So that would be kind of give us the foundation or the characteristics of the environment where this could take place. So what kind of symptoms would someone typically develop over time? And I guess one question would be too, like, did these symptoms always develop shortly after, or can they kind of crop up whenever?
So because it's over the course of months to years, it is in development,
Okay.
right? This is not just from one day to the next. So a good example of this is, let's say, as an imperfect parent, out of frustration, you say, "How did you do that? You're so stupid." These symptoms won't just pop up in a child, especially if the parent comes back and says, "I'm sorry, I spoke out of frustration." So there's that, the repair, or also if the parent never does it again.
Yeah.
So it's really the
Repetitive.
if you think about it, it's like, the washing of the sea over rocks and pebbles. They start to form it into a different shape. We're formed by these experiences that happen over and over and kind of just chip away at our sense of safety, our sense of confidence, and our ability to manage our emotions, so forth.
Okay. Yeah. So this could actually evolve over the course of, or it does evolve over the course of months and years kind of thing. Now, let's say a child grows up in this sort of environment and they're doing okay. They're kind of functioning, they're getting by. Is it possible that you could have a picture like that where and then, so they grow up kind of in this chronic abusive environment and they're doing okay, they get through college or whatever, but then maybe a few years later, they suddenly have like more of these symptoms? Is that possible? Have you seen that?
So I haven't seen that from the perspective of after they leave that environment, because they've been shaped for so long, and it's complex in the way that it impacts every aspect of your life. It is very hard for you to function.
Okay.
When people say that they did okay, it's often because they're engaging in avoidance.
Okay.
So thinking of a particular client recently where she's like, "Oh, yeah, I went off to college, I left my life." And this was after chronic rape ongoing from a family member. And she's like, "I left that life, I was okay." And drinking alcohol, right? Other forms of avoidance, having certain relationships with certain people. Now, never to the extreme, like even one of my clients said, "My mom told me no sex, and so I would never cross that line," but still engaging in unhealthy dynamics with men, or the opposite for some people is avoidance completely of relationships. But there's an avoidance that seems like it's okay, and then it pops up years later. And so I've never seen it like they're actually okay, and then just somehow it, comes to the surface. Because if you think about it, if the damage is done in the context of relationships, all of our life revolves relationships. So you might say, "Oh yeah, I was fine," but you might have a conflict with customer service. Why? Because maybe you're avoiding intimate relationships, and maybe you have no problematic intimate relationships, but one, you're devoid of relationships, and then two, it might come out in other minor things that you think are minor.
Yeah, that makes a lot of sense. And that's what I've typically seen too, is that, it's often when somehow those avoidant techniques, so to speak, are unavailable, or there's something else that happens that it's like all of a sudden they start struggling. And because now it's like, wow, I have all this stuff that I have not been dealing with. And so for people that have had that chronic trauma and seem like they're doing okay, that is something that I've seen. So yeah, let's get into some of these specific symptoms that might crop up.
So I'll mention kind of categories of symptoms, and it can be broken down further. The first one I really want to emphasize is emotion dysregulation. it is very difficult for them to manage their emotions. And that can come out in different ways along the spectrum of the lows and the highs, but difficulty regulating their emotions.
Yeah, and I think we see that oftentimes in different disorders, even like BPD, but it seems like it's also very characteristic of this. And when you think about that emotional dysregulation, when would that most typically come out or be manifest, do you think?
What do you mean by that?
Well, what I mean by that is, when would people tend to be most emotionally dysregulated or triggered? Would it be under times of stress, or would it be actually in the context of relationships typically? Or
So it's typically profuse. So
Okay.
for different things, let's say something minor happens and they react. It can be in the context of relationships. It can be a reminder of their trauma, but it's typically, we see it throughout
kind
different
of across
areas.
the board.
Mhm.
Okay, so just a really difficult time managing their emotions in general.
And with that, which is important to think of, is yes, your mood, right, fluctuating, but often then what's under this category is how you may deal with it. So for example, suicidality would fit under the category of emotion dysregulation, self-harm. And within self-harm, there's a host of different ways that can play out, including risky behaviors. So those also fit under the category of emotion dysregulation.
Okay. So what's the next category or area that we might see?
So changes in consciousness. This can include amnesia, right, of traumatic events. This can be dissociation. One very common one that I see is depersonalization and derealization. So notice it's a big umbrella from memory to consciousness in the moment, as well as which is classic to PTSD, reliving of experiences as well, similar to flashbacks.
So we see kind of that disconnect from what really, it's hard for people to stay grounded in a way, and that dissociation can be, and I've seen that a lot with people that have trauma. And it seems like, when I think about it, I've seen it with, at times with classic PTSD as well, but definitely with the CPTSD. All right, so what would be our next area?
So changes in self-perception, self-identity. So with this, you can think about, I like to use the words solid self, people who struggle with having a solid self. Who am I? With that, it's often a very negative self-perception. And so there's a lot of guilt, a lot of shame, a lot of helplessness, a lot of hopelessness. And with that too, with the guilt, there's a lot of self-blame. That's one of the things that I address the most probably with complex PTSD. There's a theme of self-blame.
So oftentimes people feel like it's their fault that this happened, or there's something wrong with me and that's why I'm struggling, which is really sad. And that makes it that much harder to really heal, because that is kind of like a secondary disturbance on top of the trauma that they already experienced.
I tell people, if you blame yourself for trauma, one reason why you can't really overcome it is because technically you're the perpetrator and you're walking around with yourself for the rest of your life. So if you never address the self-blame, you can't really heal from trauma.
Yeah, because now you're essentially re-traumatizing yourself.
Mm-hmm.
So we have changes in emotional dysregulation. We also have our changes in our consciousness that we talked about, and then self-perception. And what else might we see with symptoms with CPTSD?
So this is where we are not independent from others. So our self-perception, it's kind of a bridge to the next one of changes in our perception of others as well. And I know Judith Herman, she categorizes this under self-perception of even a sense of complete difference from others. So you already see this kind of connection to others. But within the category of changes of others, isolation and withdrawal. So that's one aspect of it. But also just in general, disruption in intimate relationships. So we're already kind of talking about that, and makes complete sense if trauma is done in the context of relationships, of why there would be disruption in relationships. Sometimes we can also see this with like push and pull, which sometimes also is very categorized under BPD, where they're kind of confused. In Judith Herman's book, she talks about paradoxes in trauma. And one of the paradoxes is that with trauma, you're deathly afraid of other people, and yet you're desperately yearning to be connected.
Yeah.
And so that can be confusing.
Very confusing.
For them. And that's where sometimes they have the push and the pull. I want to be close to you. And then you do any little thing that I might perceive as harmful, then I completely push you away and isolate.
Yeah, I hate you, please don't leave me kind of thing.
Yes, exactly. But also persistent distrust. That's a key element of complex PTSD. Later, there's an episode on CPT, and this is one of the areas that it really addresses, like a whole module just on trust, to learn how to rebuild that trust, not in a naive way of, okay, I need to trust people now. It's, yeah, people hurt me and I need to discern between those who will hurt me and those who I can trust. And then as well as repeated search for rescuer. So this is kind of the opposite of isolation and withdrawals. Sometimes they're looking, and this is really sad sometimes because this is the pulling, right, of wanting to be loved and wanting someone to rescue you, a savior, that you might actually attract another perpetrator, and you can continue the cycle of prolonged trauma.
And that's one of the saddest things that I see when someone's been traumatized. And then, and part of it, I think, too, is that they develop kind of this relationship paradigm. This is what a close, intimate relationship is supposed to look like or feel like. And then it's easy to fall into that trap again.
This is why sometimes we see individuals who suffer with these things get connected and in a relationship with narcissists.
Yeah.
Because they have a savior complex. And therefore, I'm looking for a savior, someone to rescue and help me. And I'm very vulnerable and I'm used to subjection. And so, yes, they have this sense of protection from this partner, but then that sense of protection ends up also being an unhealthy dominance.
Yeah, yeah. So what else might someone experience?
So this is in a separate category from for Judith Herman, but it's really under the umbrella of relationships, is changes in your perception of the perpetrator. Mm-hmm. So this is where there could be a preoccupation with the relationship with the perpetrator, which a person from the outside might think like, that's the perpetrator. You want nothing to do with them. It's kind of like the Stockholm syndrome, right? Where people can, and you see this a lot with kidnapping, with other sort of those experiences of that people end up like falling in love with their perpetrator, and you're like, wait, what?
Yeah.
So there can be those changes, unrealistic attribution of total power towards the perpetrator, right? They're thinking like, I can't escape, and you can. This happens a lot with domestic violence. Idealization or paradoxical gratitude. This is kind of similar to the Stockholm as well. Sense of special or supernatural relationship, acceptance of belief system or rationalizations of perpetrator. So again, with the dominance of the perpetrator, they can really start shaping the way that the individual thinks as well.
Wow. Yeah, it's amazing how even someone that's hurting us, there can be that distorted sense of like, oh, maybe this person is really good for me in some way, and I need them in all of this. And then it really keeps people in that cycle, even if they do have the choice to leave.
Often with childhood victims of trauma, I'll have them, write down the certain things that they believe, like I'm stupid, I'm ugly, whatever it may be. And then I say, okay, where did you first hear these from, the perpetrators? And this is in relation to kind of adopting the rationalizations of the perpetrator. And I say, are they a reliable source? And just that fact alone of realizing, whoa, I've been replaying this tape for my father, for my mother, or I had a client this week. We were like, my mom first told me this. And I said, okay, and tell me about your mom. I already knew about the mom, and he knows that I know about the mom. And he said, yeah, she has borderline, she has other mental health problems. And I'm like, reliable source? He's like, no. But it helps people realize, wow, I've
Yeah.
just easily accepted. And a big part of it, especially not just in childhood trauma, but also later on, is they have a weakened frontal lobe, and their brain has often been wired in that way that then doesn't allow them to challenge that belief because they don't have the filter of our brain that says that's wrong.
Yeah. Wow. Really fascinating. So I think there was one more, right?
Yes. And this is one of my favorites to talk about. Alterations in systems of meaning, loss of sustaining faith, sense of hopelessness, and despair. And this is one of my favorites, not just as a Christian, but I think it somewhat comes from a place of knowing that the field of psychology often dismisses this area or doesn't touch it. And if you think about that, even the language she uses, systems of meaning, if you understand that trauma attacks and disrupts your systems of meaning, systems, I think about like a foundation, a structure in which we find purpose and meaning in life. If that's disrupted, how can you really be whole? How can you really live life satisfactorily? And so addressing how does trauma impact the way that you view life? How does it impact the way that you view God? Everybody goes through a question of whether or not God is true, God is real. And I think for anyone, especially those who are unbelievers, but also those who are believers, I'd highly encourage them to take a look at how might have my traumas impacted first, my belief in a God or not a belief. And then if you do believe in God, my perception of who he is. And I think that if we're honest with ourselves and realizing, yes, it does disrupt our sense of meaning, that's important to look at, as well as just in general, what's my purpose in life? And asking those big questions, whether you're Christian or not, just asking the questions, what's the purpose of life?
Yeah.
Why am I here? Yeah. Where am I going? And those crucial questions to ask. And trauma completely disrupts those.
Yeah, and I'm thinking here too, as you're talking about that reliable source idea, because when we think about how people even develop their picture of what God might be like, studies actually show that the most important figure in their life is their mother. And then, of course, their father also has a lot to do with that as well. And so then I'm thinking like, well, if you had trauma, for example, from your parents growing up that led to CPTSD, and could that affect your picture of God? And of course, yes, it can. And then the question is that a reliable source, right?
Exactly.
And with trauma, and someone that's a perpetrator, we would have to say, well, no, they're not a reliable source for what God is actually like. And so this is a really key element, I think, for us to consider, even like you said, in our belief system and where that might have come from and how accurate of a picture we might have, whether it's our view of God or just our overall belief in spiritual things and this sort of thing. So.
And even for people who say, well, no, my childhood was fine, but a partner or spouse, if that's an intimate relationship, which would naturally also impact how you view God. People in the church, if you grew up in church, they'll impact your view of God. And I just tell people it's really important for you to explore these things for yourself,
yes,
apart from perpetrators. So you need to define how you view people from those individual people. Be fair to them, not from your perpetrators. But the same thing applies to God. You have to view God who he says he is and how he shows himself to be, apart from what other people say or other people show you. So
Absolutely.
being fair for even yourself, of looking at yourself for who you are apart from what your perpetrators have said.
So when we look at all these symptoms, what we see is it really going through chronic trauma and setting the stage for CPTSD. It really does cause all sorts of alterations with our relationship with ourselves, with our relationship with others, our relationship with God, our relationship with our environment, and then, of course, the emotional regulation that can take place as part of all of this. And in essence, it really alters everything about our lives. And so as we end, and I want to give our listeners a little bit of encouragement and hope here, the good news is there are actually things that can be done. And we are going to have a part 2
Yes.
where we're going to talk about some of those things that we can do to address. But Dr. Katie, could you give us maybe a little teaser? Because before we started the podcast, you mentioned 2 primary areas. So maybe you could just briefly mention those so that, again, I want our listeners to go from this podcast realizing there is hope for recovery from CPTSD.
Yes. So the 2 main things is empowerment and connection. And I'll leave it at that.
All right.
It's so beautiful. And I'm so excited for that episode because if you really boil down these symptoms and these experiences, its power has been robbed from us, and a sense of choice and autonomy, and our connection with others and with God has been really destroyed. And we see that that's directly from the enemy, because those 2 things are essential to God's kingdom, is power of a sense of choice and free will, and also connection. So I'm really looking forward to talking about that.
All right. Well, thank you, Dr. Katie.
I want to say one more thing,
Yes.
though, for those who have maybe experienced a lot of mental health difficulties. If you haven't talked with a clinician or provider about the possibility of having complex PTSD, I've seen that a lot of people are kind of been in treatment for so long and are getting very discouraged. I'm not getting any help. And it's often because this hasn't been diagnosed and it hasn't been addressed in therapy. So I'd encourage people to just explore the possibility. Don't leave here and saying, for sure I have it, but explore it in a way that perhaps they've been struggling in these ways and they didn't know. And finally, there's a diagnosis that can maybe capture that for them, but looking for treatment that may be specific to this and addressing it.
Thank you again, Dr. Katie. And that hopefully ends things on a note of hope and encouragement for all of you out there, realizing that yes, we do live in a world that is full of suffering. But as Helen Keller said, she also said there are also so many examples of people that have overcome that suffering. And by God's grace, that's exactly what we can do. Thanks for listening. If you enjoyed today's episode, please like and subscribe. Your engagement will help us reach more people who need encouragement. To hear more episodes, learn about our other mental health resources, or support us financially, visit thebrainpeoplepodcast.com.